I was walking by the graveyard late last Friday night. I heard somebody yelling, it sounded like a fight. It was just a drunken hobo.
I think that what helps the most is a combination of sort of matching a therapist with a patient. I mean, the patient or client or whomever, the person with mental illness who's seeking help, can relate to that person, and that the therapist can relate to also to the patient. If you get a scratch and you have an antibiotic and a bandage to put on it and catch it, when it's still a scratch, it'll heal. But if you don't have the means, if you don't have the logistics or whatever, even to afford some antibiotic and a bandage, that scratch is going to fester and become a wound, and it's going to become gangrene, or you're going to lose your leg, and then you're going to die. And I think it's the same thing with mental illness. I mean, I think that if you catch it in earlier stages before it leads to greater harm for a person and society in general, because I think if mental illness, can be caught before it ruins a person's life, because I think people can get in trouble. Because of behavioral problems. Because if in terms of harming themselves, maybe, and not just taking care of their basic needs because they ignore them because they feel so bad about their situation, or not having the financial means, or being poor, not even having the financial means to take care of necessities, shelter, food, health care, things like that. If you don't have that very basic foundation, people can't recover. They can't get better. They'll just stay down there and get worse. It's not moral. It's just not moral to let other people suffer like that, because there's a lot of suffering that's going on.
When you leave it for a while, you'll find the broken-hearted when you're traveling jungle style.
Another analogy would be, that scratch is a scratch like on society, and it's going to fester unless it's healed. I think it could be healed by by putting a bandage on that wound, and that would be by laying a safety net below people that they can't sink below. I think that's the issue. I think it's I guess the humane thing to do is to set a safety net like that, so that people don't suffer.
That homeless brother is my friend. The ghosts.
The way we let people think in this society, they die. They basically die. They don't have health care. They can't prevent their disease. They end up suffering and dying, and it's a huge cost to society. So it's in everybody's interest, no matter how they look at it, whether they look at it as a social humane issue, or whether they just look at it as they're just looking at their own selfish self-interest. It's in everybody's interest to help people at the bottom not fall through the net.
As you please, well, the victim of our riches often dies of our disease. He can't hear the factory whistle, just the lonesome freight trains wheeze. He's living on good fortune, he ain't dying on his knees. Smash your bottle on the gravestone and live while you can. That homeless brother is my friend. That homeless brother is my friend.